Hello and welcome back to the channel. My name's Dr. James Gill and you've joined us for another video with regard to clinical skills. Today we're going to be looking at more clinical skills for the patient. We're going to be dealing with ambulatory blood pressure monitoring or home blood pressure monitoring, as is more likely the case. Ambulatory monitoring is where somebody will wear a device, something like that, which will randomly check their blood pressure for 24 hours. However, a lot of the time what we'll end up doing is we'll give a patient a blood pressure monitor to check their blood pressure at home. So whilst I can do a patient's blood pressure using a manual sphygmomanometer, obviously most patients don't have one at home. And sometimes we'll get a patient who's come in, they've for example had a medical at work and they've been informed that their blood pressure might be up and they need to come and get it checked. The thing is, that's just a one-off shot. It's a little bit like looking out of the window and saying, is it raining now? Just because it's raining at that moment in time doesn't mean it's raining all the while. Your blood pressure can ebb and flow. And even if the patient has a raised blood pressure when they're in the practice with you, again, that doesn't necessarily mean that they've got high blood pressure. I mean, we're all aware of white coat hypertension, that phenomenon where somebody comes in and their blood pressure is raised. What we do is, we've just seen with the Thava, we will check the manual blood pressure, and if that's raised, then we'll talk about a home blood pressure monitor. So the purpose of that is to try to smooth out these dips and peaks of the blood pressure to give us a true reading. Now, it sounds like an awful lot of work getting someone to check their blood pressure twice a day, 2 sittings, with their feet flat on the floor, sat upright, arms and legs uncrossed, not talking to anybody, and ideally not looking at the blood pressure monitor numbers. You know, that's a lot to ask of people. However, if we are able to adequately control people's blood pressure, then it's thought that we'd save up to 500 strokes every year and 750 heart attacks. So blood pressure is a huge thing as a silent killer. And if we can get people to have buying themselves or using our blood pressure monitors at home, we can get a much truer picture, and that means that we can get a much better monitoring of what the variation in their blood pressure is and how they do with any blood pressure medication or lifestyle and diet changes that we might offer them to try to control that blood pressure. So one of the things we're going to do now, because the Thava's a good sport, we're going to torture him once again, just to highlight how blood pressure does change with regard to variations in the day, and thus why home blood pressure monitoring is important. So obviously the video we've done earlier where we've simulated doing home blood pressure monitoring is fake. Thava doesn't have raised blood pressure, but we're going to check his blood pressure here and then we're going to set him a small challenge. Let's do that on. Okay, and this time we'll keep the numbers towards the camera because obviously there's no need to fake it. Now, you can get individuals, young people with high blood pressure. That's a much more of a concern for myself. So I want to think about, is there a hormonal problem? Are we looking at a problem with their kidneys? Could this be a vascular problem? So person under the age of sort of 45 with raised blood pressure, I'm going to want to concentrate an awful lot more on. So that's the reason why you didn't see a Thava's blood pressure numbers when we did the monitor earlier, because, well, thankfully, a Thava doesn't have raised blood pressure. So the system's coming down. And this is doing exactly the same as my stethoscope. It's listening for the Korotov noises. When the Korotov noises will disappear when we've gone over the systolic, and they'll reappear when we come off the systolic and then disappear again for the diastolic. So a Thava's blood pressure is 108/65. Let's see what happens with a little bit of exercise. So there we go. So we've just had a Thava pegging, technical term, up and down the stairs. We can see the breathing now. He's sufficiently lax in oxygen as he can't even work out how to put the blood pressure monitor on. And we'll see if the numbers have gone up. So obviously a highly unscientific test, but it's to try and show, whether or not we can move somebody's blood pressure with great ease just during the day. Now, whilst this is going up, we need to understand what the systolic blood pressure is. That's the maximum pressure that the heart is exerting when it's pumping. Conversely, the diastolic is the resting state. That's the pressure when the left ventricle isn't contracting. So certainly I'd expect his systolic to have gone up because his heart capacity is working much harder at the moment. His diastolic should probably remain relatively similar. There we go, so Athava is nearly hypertensive now. We've got a systolic of 137. However, his diastolic, the resting state, is still at 64 because he's got a healthy cardiovascular system. So his heart's working harder, pushed the blood pressure up, but the diastolic's remaining nice and low. His pulse, showing he's done plenty of work, is 103 at this precise moment in time. So, thank you for that. You can take it easy now. But that does reinforce, why we want to do the home blood pressure monitoring, so that we can iron out these peaks and troughs and get a true reading. Bear in mind, stage 1 hypertension, where we're just ticking into blood pressure at say 135/85 when monitored at home, is where we would really want to instigate sort of lifestyle advice, really help the patients optimise their world so that they can hopefully reduce down blood pressure. A simple example for that is adding beetroot into the diet, because that can reduce blood pressure by about 5%. However, if that blood pressure is higher, and we're talking sort of stage 2 blood pressure, then we might be seeing end organ changes, for example, issues with the kidneys, and we're going to want to push much more firmly with the patient and maybe looking at adding on medications. So depending on a person's age, a young person would start off with an ACE inhibitor, so for example ramipril. Conversely, somebody who is over 55 would go with a calcium channel blocker to begin with, such as amlodipine. I think that's pretty much all we need with regard to home blood pressure monitoring here, but if you'd like us to do further videos on blood pressure and maybe look at the medications we'd use and the other stages of blood pressure, drop it in the comments below and we'll see if we can help. Take care, we'll see you in the next one. Thank you.